Pharma, Farm Coach. So, hi everyone. So, who here has been to driving school before they got their license? Raise your hand. Why do we do that? Well, we don't want to end up like the taxi drivers and the mini drivers downstairs, right? Driving is a life and death situation. Healthcare is a life and death situation. If there ever was a day where healthcare is life and death, it's today in the year 2014. If you're not familiar with National Quality Strategy, it's the NSA for the ACA. Basically, they can pull any string, any wand they want, any wand they can use to lower reimbursement rates for providers. Farm Coach is a solution to maximize your reimbursement rates, improve medicine education for patients, and ultimately afford better healthcare outcomes. We're taking medical expertise and education and combining them. Because if you can win with medicine, you can win with health. So a lot of what we can talk about today is about monitoring, fitness, tracking. Really, with the CMS dollar, that's about 25% on a rating scale of what gets reimbursed on a pro-performance basis. The other blue part is what we decide what medicines we want to use, how we want to diagnose them. But what we haven't talked about today is the red part. It's called patient experience, and that's done through surveys. In the early 2000s, hospitals were doing this. It's called HCAP surveys. Guess what? It's coming to a private office near you called CAP surveys. And one of the major weights of a CAP survey is how well did you learn about your meds. Farm Coach solves that problem. We take a get patient command and get clinical summary from all scripts from Stella Patterson. We got her med list. And we've made a pictorial representation of all the side effects and indications of her medicine. After our consultation session, we upload it with saved document onto her EHR record. We send it back to Better Doctor for an improved score of the physician, and we send it to Stella as well. We have billing codes, what's called medication therapy management. All this is paid for by the health insurance. And so we're going to go into a quick demo. So with a seamless login from the EHR portal itself, that we can use, which would effectively avoid this step. We go to the doctor summary with the list of patients. We'll select Stella. She's set for some medicine education. We get her medicine list, and she's taking furosemide, atorvastatin, and metoprolol. She's got cardiovascular issues, okay? She might have been prescribed these years ago, but she still needs to get educated on them because she doesn't know how to take them, what their side effects are. So let's select those. And we build customized consultation points that are approved by the physician and for anyone in the practice to use. So we're going to talk about dyslipidemia. We're going to talk about primary and secondary prevention of cardiovascular disease, myalgias, dark urine. And finally, we can upload all this into a PDF, send it to the patient. Thank you very much. And we can take your questions. We wowed you.
It's hard to compress this into 3 minutes. So
yeah.
So you're sending a survey to the patient. Basically, here's a questionnaire we want you to fill out on the meds that we think is important for you to be trained on.
We select the meds that are high risk, and we prioritize them. We give them pictorial, customized education points. We package it. We send that to the EHR. We send that to the patient. And we also upload the statistics onto the doctor profile.
Right.
So ultimately, it's a three-way win.
Okay, so I saw the all scripts integrations. You're saying that they did that to Better Doctor?
Yes, so we talked with them early on about not only retrieving information from the site, but also creating a customized scoring system so that at the end of the day, doctors can rack up education numbers. If I go to a cardiologist that I know has counseled 1,000 patients on my medicine, I'm much more likely to go to them.